Good morning, Internet. Good morning, Internet. So I'm just gonna go ahead and upload the vlog from yesterday. It is 7 a.m. Not sure what's going on. The window is really foggy. So this is going to be my mom's 17th day for Ramadan fasting. Yesterday's vlog is uploaded. Okay, so for my lips, I did a light baby brown all over the lips. I did Hoola bronzer to contour my cheeks, and I used Coralista by Benefit Cosmetics. And then on top of the baby brown, I went in with Audrey by NYX. Hey guys! Nuzrid. It only takes 5 minutes to make the coffee. Butter on bread, and this is plain yogurt. After work. I didn't really finish my breakfast. Like, I had the round bread. I think I only ate half of it. Left my phone at home. I have like no idea what time it is. I think it's like 8:30, but I just got to work and my phone is broken. I'm thinking that I'm probably just gonna replace my iPhone with my LG G4 that I have already. It's not quite in such a bad shape, but yeah, but now I don't have access to any of the phone numbers. I have my lunch now. This is the chicken and the split garbanzo beans with rice. That is the green chutney that my mom made. It's like a mint spicy like green chili pepper. Alright guys, so I just got back. My mom has already started eating. I think it's like, I'm not sure what time it is. Let me check. It's 8:58, so I think my mom would have opened her fast at about like 8:20ish. So yeah. So today I had 3 patients, and so for one patient, she came in with chest tightness and kind of like coughing, and I don't remember what we gave her for that. I think, yeah, so we gave her a shot of Rocephin on the left hip, and basically how we did that is we drew up some lidocaine, about 2 cc's of lidocaine in a 5 cc syringe, using like, you know, any gauge of needle to draw up the lidocaine into the syringe. So I pushed some air into the lidocaine bottle, and I was able to draw up 2 cc's of lidocaine. After that, drew up the lidocaine, and then I inserted the lidocaine into the ceftriaxone. Comes in like a little glass vial, and sort of like a little bottle, and it's for one use only. So I just inserted the lidocaine into the ceftriaxone bottle, also known as Rocephin, and then mixed it. So I had to like stir for like maybe 4 or 5 minutes until basically everything was thoroughly mixed together, because ceftriaxone is actually a powder, and the lidocaine is a liquid. So we had to make sure that it was nice and clear before actually using it. So after that, I drew up after mixing it, I drew up the Rocephin into a syringe using the same needle, and then threw away the needle, and then I got another needle that would be more fit for an intramuscular injection. So I got the gray top needle. It's a pretty thick, long needle. And yeah, so then I drew out the ceftriaxone and lidocaine from the Rocephin bottle, and yeah, so I had to push some air into the bottle by drawing some air out into the syringe that I was using, and pushing some air into the bottle with the Rocephin in it, and drew out the entire contents of the bottle. And basically, so it was injected on one of my patients' left hip. And so what I did was I kind of got my hand like this in a shape, just asked the patient to lower their pants just a little bit, just about that much. You don't really need to have them to, and then just kind of like squeezed a little bit and then just poked right in the center with the syringe. And I did ask him to cough, so it was like 1, 2, 3, cough on 3, and then like a dart. Aspirated a little bit, so I sucked a little bit back using in the syringe, so that to make sure that I didn't hit any major blood vessels or anything like that. No blood. So I just continued to slowly inject the contents of the syringe, and then that was it. It takes about like 1-2 seconds. Withdrew and discarded the syringe into a sharps container. Yeah, so and then I had to keep the ceftriaxone bottle to basically make a record that of the lot number and whatnot of that. And then yeah, so that was one of my patients. Another patient came in for an earache, and she had really high blood pressure. I think it was up there. I don't remember what it was, but it was up there, because she had only just taken her medication for hypertension about an hour back. And yeah, so those were the 3 patients. So my first patient of the day pretty much was like a comeback. She had been there before for postnasal drip, and her symptoms were worse today. And then the other day we had a patient that came in for a dog bite. This person had a dog bite occur on his left calf region. So yeah, and from what I was able to gather, it was a medium-sized dog, which kind of means like it was definitely not a Chihuahua. Like it was kind of a medium to a large sized dog. We don't know how large though, but yeah. So we treated that with a tetanus shot, just because, you know, we're not able to produce records of when the patient had their their tetanus shot last. And we also, I believe we gave him a tetanus shot. I don't remember because I didn't administer it, but yeah. So I believe the dog bite was treated with like peroxide and like saline solution. So yeah, but we did have to report that to the county. Any dog bite that occurs and everything like that, we did have to report that to the county to where it occurred. Yeah. I had a patient that came in that was 14 weeks pregnant, and she was recently into it. She had gotten into an altercation, and she fell down, and she was kind of like an overweight person. She fell down, and I think she kind of like fell on her ankle, and she kind of injured her ankle a little bit, so we had to use an ankle brace that we had there, so by ProCare, I believe. It has like a blue gel for the ankle brace. It comes in like a plastic packing type of thing. And then like the sides of it are plastic white, and then they're like sealed. So and then our practitioner kind of put it on, with the Velcro on her ankle, and I believe she was a, yeah. So she was a Medicaid slash Medicare patient. And then one of the patients that came in today was complaining of chest tightness, and he was experiencing cough spurts lasting for 2 to 3 months for the past 4 to 5 years, just coughing. And like if it's a labored cough, then it would like produce like a yellowish colored discharge. So I think now I'm gonna go ahead and have some dinner. So my toilet kind of broke, I think it was yesterday, and there's like water leaking everywhere. I think it must be coming from the toilet, but there is a lot of water. Like this whole area is just like a puddle of water. And then when I come around over here into my room, there's like water actually coming out from the floorboards. So there's actually a puddle of water right there, and it's just like, yeah, there's like water coming out of like, just wanted to step outside, like the clouds, like the sky looks really, really pretty. I love it. Again, can't see any moons, so I'm having some dinner. This is plain brown bread, and then this is pretty much potatoes. Like, I don't know what else is in there besides onions. So this is my LG that I was previously using but no longer use. But yeah, guys, so I'm gonna go ahead and close the vlog for the day. Thank you guys so much for tuning in. Please remember to like, share, comment, and subscribe, and I will see you guys on the next one.